Hi there, my name is Nathan Johnson. I am the Chief Policy Officer here at the Washington State Healthcare Authority. And today it is my privilege to introduce you to the first of several videos we're calling whiteboard sessions on our Medicaid transformation waiver. Our goal today is to give you just a flavor of what Medicaid transformation means for our state, and also remind you that these demonstrations are at times complicated. There's a lot of moving parts and pieces. We certainly won't have time today to cover all of those complex pieces, but at least give you a high-level overview that allows you to engage in this process meaningfully going forward. So then you might ask, what is an 1115 waiver? Well, the first thing I might say about that in answer to that question is, let's not get so hung up on the word waiver. What we're really talking about is a demonstration of what Medicaid transformation can mean in the state of Washington. It also is a few other things as far as the federal government is concerned. It is a 5-year agreement that is binding on the state and on our federal partners. It allows the federal government to invest in this state. For the federal government, though, to invest in the magnitude that we're asking them to under this approach, it must be budget neutral, meaning that over the course of this demonstration, we must show how we're not spending any more federal dollars than we would have absent this demonstration. So there are 4 fundamental goals in our Medicaid transformation effort. The first is we want to reduce the use of avoidable intensive services. And here's what we mean by that. If we can avoid a very costly stay in a hospital setting, in an inpatient setting, we want to do that by better intervention, better primary care, and a better organized delivery system. If we can avoid a long-term stay in a nursing facility by preempting that long-term care need and addressing elderly individuals in the place where they reside, we want to do that as well, and the Medicaid program benefits a great deal if we're successful. But it's not just about healthcare institutions, it's also about jails and prisons. There are a lot of folks that end up in jail or prison on account of untreated mental illness or untreated substance abuse. If we're successful in this Medicaid transformation effort, we'll be affecting those avoidable intensive services as well. The second thing we want to do under this Medicaid transformation effort is improve population health. This is a little bit of a different approach for the Medicaid program than the ones we might be used to. Sometimes we target a particular subgroup or eligibility group that Medicaid serves. Other times we are particular about a specific disease or what have you that we want to address. In our effort, we're really looking at total population health improvement and recognizing the system levers that have to be pulled to achieve that. The third goal we want to achieve is to accelerate transition to a new model of payment to providers. We want to reward value and outcomes, not volume and widgets. This is a big change. This is a big change whether you're talking about health plans or the providers receiving that payment, or for that matter, a state agency like the Healthcare Authority. We want to leverage this 5-year demonstration to make significant investments in provider, plan, and state capacity to convert our volume-based payment system into one that rewards value. And finally, if we're successful on all 3 of these large goals, we want to bend the cost curve, meaning that we want the Medicaid inflation to be less in this state than what it is around the rest of this country. If we're successful, 5 years from now, we're going to have a Medicaid delivery system that looks radically different. And here's what I mean by that. First, we're going to have a delivery system and state agencies and payer partners and community partners oriented towards whole person health, meaning that we're not going to artificially separate someone's head from their body in how we deliver services to them. Whether they have a mental illness concern, a substance use disorder, a medical issue, or perhaps all 3 occurring at the same time, we're going to have a system motivated and properly incentivized to address those whole person healthcare needs, as opposed to the fragmented system we have today. If we're successful under this Medicaid transformation effort, we're going to have providers with brand new capacity, whether it's in their data systems, in their workflow, or in their service delivery approach itself, to deliver again on the promise of value-based payment, meaning as we increasingly hold them accountable for outcomes, they're going to have the tools to be successful in that. The other thing we'll have is a more engaged consumer base, meaning as this delivery system becomes more responsive to their needs, we expect Medicaid consumers will become much more engaged themselves in their own care and the experience of that care being delivered. We will have an aging and disabled population whose needs are being better addressed before they wind up in a long-term care facility or setting. We're going to have targeted services available to those most in need, in particular those suffering from inadequate or no housing at all. Those who have unstable employment and perhaps because of a mental illness condition are on a track to disability. We're going to be able to properly intervene and deliver medical services as well as other supportive services necessary to really achieve that triple aim for individuals, improving their health, improving their care experience, and lowering their costs. We do believe a transformed Medicaid delivery system is possible. In particular, we believe it's possible because of the partnerships that are already occurring across this state, led by accountable communities of health and with the involvement of many, many sectors, both those traditional health sectors like providers and plans and public health entities, as well as those that may not be as traditional to be involved in health transformation work, whether it's housing providers, philanthropic organizations, or even faith-based communities. This partnership is the secret sauce for Washington State's Medicaid transformation effort. Thank you for joining us in this crucial work. And if you'd like to know a little bit more about what we're doing and how you can be involved, check out this website. We'd love to have you engage with us as the important work really, truly lies ahead of us. Thanks so much.